Hi, good evening. I'm Dr. Kayan, Siodia, consultant interventional cardiologist at SL Raheja Hospital. And today I am going to, on this wonderful occasion of World Heart Day, I'm going to speak a little on what constitutes a healthy heart. And that is actually the key to what today's generation actually wants to know and today's generation wants to see. So, we undermine the importance of cardiac issues, especially in younger individuals, especially after COVID. So, 18.6 million deaths happen from cardiovascular disease, which constitute around 33% of all global deaths. And more than 75% take place in low and middle income countries where healthcare systems are not up to the mark. We are scared of cancer, respiratory diseases, HIV, but knowing fully well that cardiovascular diseases is the biggest killer that is there in today's age and time. So this is just a brief overview of talking of how heart diseases affects the other body. And when I say heart diseases, I don't only mean a heart issue. It even constitutes and takes into the global phenomenon even of a stroke, that is a blood clot in the brain. So I'm just going to speak briefly on both of them and how do you identify most important issue in today's day and time, especially among in our country, is knowing the symptoms. Because half the times we see that individuals neglect the symptoms, saying that it's just gas or it's just abdominal discomfort or just acidity, and they really are having a heart issue. Most important is chest discomfort. Chest discomfort need not only be on the left side, it can be even in the right side or in the substernal part, or it can just mimic some acidity like feeling. And they generally involve the center of the chest, and the classical symptom described is heaviness or as if something is squeezing them from inside. However, no chest pain should be taken lightly, and it is important that we look at the chest pain from the heart aspect also. So, as I discussed previously, it need not be only on the left side, it can be in the upper part of the body, anywhere. It can even present with just shortness of breath, which increases on exertion, and even can be there even at rest. The other signs, though subtle, something like a cold sweat or nausea or lightheadedness, is also something we'll be looking at. So, as I said, from head to toe, we talk about most importantly pain and discomfort in the chest, followed by lightheadedness, nausea, vomiting. The pain may radiate to the jaw or the left hand or the right hand, more and more frequently the left hand, and shortness of breath that we spoke about. Coming to the stroke symptoms, we have a mnemonic of fast, that is facial drooping being the most important, where somebody may just complain of heaviness in the tongue, or you can see that the face is deviated to one side. They may even complain of numbness or weakness in the upper parts of the limbs or the lower limbs also. So sensory and motor both have to be taken into account before attributing it to stroke. Speech difficulty, speech may become slurred, the patient may not be able to recall what has happened, patient may not be able to comprehend what somebody is speaking or may not be able to verbalize. So all this falls under this purview. And time to call for help. If the person shows any symptoms, even if the symptoms go away in a few minutes, it is imperative that we seek medical advice. The other symptoms would be numbness, confusion, trouble, probably visual disturbances, patient having imbalance while walking, and severe headache. Don't attribute severe headaches only to migraines. That can be a part of the stroke itself. So I like this also what is written on the slide, that be fast. Balance is important, vision is important in the form of eyes, facial droopiness is very, very important and a sure indicator that something is wrong. Arm weakness, speech and time, as I said, holds the key. Cardiac arrest symptoms, so sudden loss of responsiveness, you tap the shoulders, you speak out, you yell out, you shake the patient, but still is not able to respond to it, then it is time to act. Do not take time. So there is an actual basic life support protocol, which I am, in the want of time, I am not able to cover that part. But basic life support should be initiated then and there. Call for help. Immediately call for help. Even if you feel that the patient is sleeping, it is not bad in just going and trying to wake the patient up, shaking the patient up, and tapping the shoulders and saying that call for help. Start CPR. CPR, everybody should know what CPR is, how to perform good quality CPR. Automated external defibrillators are now available in all malls, railway stations, airports, and it's important. Call for emergency medical services as soon as you can. So early recognition and intervention is the key for survival in cardiovascular events. Every minute delay increases morbidity and mortality. So with every passing minute, so I generally say time is muscle when a patient is having a heart attack. So the longer time you take, the more the muscle of the heart can be damaged, or more if it's a stroke, the more of the cells of the brain can be damaged. So this diagram actually shows that how the brain with every passing minute can cause issues. So time is the key. Do not hesitate, call for help and take the patient to the nearest hospital. In younger individuals nowadays, I generally get this question: why the younger individuals are starting to have strokes and heart attacks? It's most important is because of their lifestyle. Something very important to know: what is metabolic syndrome? It is a syndrome which encompasses increased cholesterol, your sugars are elevated, blood pressure is high, your weight is high, and triglycerides are high. So, in we are coming, especially our country, we come from an era of famine to an era of excess. I'm talking about food here. So junk food, the Western culture coming in, obesity increases, which in turn has this vicious cycle of increasing blood pressure, increasing your sugars, your cholesterols, and that is important. This is a busy slide, but this is all I wanted to bring forth, that what the entire health screening should encompass. So I do generally tend to have individuals who say, I'm just 40, I'm just 45, why should I undergo any health screening? But it is in today's day and age where stress is such a non-modifiable risk factor, as I'd like to put it, where India has become the capital of diabetes, obesity is on the rise, heart attacks are on the rise. It is essential that all young individuals go ahead and get their regular checkups done. So I've divided these factors into non-modifiable and modifiable. Being a male with increasing age, positive family history. When I say positive family history, any male member of the family less than 50 having heart issues, or a female less than 60 having heart issues, accounts for a positive family history. Genetic factors are also very important. Type A personality, person who's always stressed, person who is hyper. These are the non-modifiable risk factors. We concentrate more on the modifiable risk factors, that is your smoking, alcohol consumption, sugars, blood pressure, elevated cholesterol, obesity, stressful living. Now, stress, very important. Stress, I would rather put it into a non-modifiable risk factor, because in today's age and era, there is nobody without stress. It is how you deal with the stress is actually what's going to be important. We do a battery of tests, we do panels of tests, and time and again, I've put this slide up for a specific reason. Time and again, people come to me that my CRP is high, so I have heart issues. CRP is just an acute phase reactant, means any inflammation in the body is going to increase your CRP. Well, how does the artery of the heart clot? So there are plaques which are formed. In these plaques, which are cholesterol rich, lipoprotein rich, they burst, and these are thrombogenic. That is, the clotting factors can easily clot the blood around that heart. This is because of inflammation in that heart. So what I'm talking about is inflammation at microvascular levels. And that is why CRP also goes in a heart attack. But a high CRP does not necessarily indicate that a person is having a heart issue. It's very, very important to know that. The other thing which has come into a picture with a very big way is lipoprotein A, where it is suggested that lipoprotein A, which is higher, especially comes down with generations. Lipoprotein is a risk factor for developing heart issues, which is true. And there are medications which are in phase 3 trials which actually have shown that decreased lipoprotein A can decrease your chances of having a heart attack. So measuring lipoprotein A is very, very important. So family and heart diseases, everybody knows that a young person who has a very, very strong family history will say that I'm leading a normal life, but I still had a heart attack. I don't smoke. I have nothing. I have no vices, but I still have a heart attack. Genetics cannot be changed. So it is important that we understand that genetics also play a very crucial role in this. Now, women and heart diseases is a very big topic which we can discuss. So, contrary to popular beliefs, a woman in her fertile age group, that is prior to menopause, the hormones in her body, the estrogen and progesterone, are actually protective in developing heart disease. So, less than 50 to 60 years of age, you will see that women have much lesser incidence of heart issues. But after 60, their incidence is equal to men. However, we are seeing that with the rise of issues like PCOS, with the rise of women who smoke, women who drink, the chances of them having a heart issue have been on the rise slowly and steadily. Pregnancy is also a risk factor which actually elevates heart attacks. So you generally don't see heart attacks in pregnant individuals, but post pregnancy, we see that there can be complications like increased blood pressure, they develop sugars which are on the higher side. Now, postpartum or peripartum hypertension or pregnancy induced hypertension, as it is like to be called, generally you will see that they subside after pregnancy. However, it is essential that these patients be followed up on long-term process because they have been known to have increased chances of heart disease and blood pressure later in their lives. I'm not going to go into the details, but generally when you have a heart disease, you will be prescribed blood thinners, which are very, very important. Statins for cholesterols. Now, statins, people have this wrong notion that statin is only for cholesterol. Now, statin has something called a pleiotropic effect in which patients don't understand that statins also act at microvascular level to decrease inflammation. If inflammation decreases at microvascular level, the chances of them developing a clot decreases. So statins are actually protective also in these scenarios too. Medication adherence, we see that the patient once has a heart attack, they are beautifully compliant for the first 3 months. Then they feel they're absolutely all right and in their own accord stop their medication, they become their own doctors. But they don't understand that the issue has not been settled, the issue has not gone away. You have to have medication prescribed by you, by your health worker at the right amount, right time, right way, and the right duration. We should not, as lay people, decrease medicines or stop medicines in our own accord, thinking that we are going to be all right. How do you deal with these patients who have coronary artery disease or heart blockages as they are known? So there are multiple screening tests. The patients come in with stress tests, dopamine stress echoes. I see young individuals doing CT coronary angios left, right, and center. But please be advised that CT coronary angio, most important is something called pre-test probability. So the chances of you having a heart disease are so low that there is no chance of you having heart disease. Doing a screening test of a CT scan does not make sense. Most important is CT is radiation. You are exposing yourself to radiation. You are exposing yourself to dye. You cannot keep doing that because they have their own side effects, and don't keep doing CTs just for the heck of it. Then if a stress test or something come positive, stress test is more like a rule out test. A negative stress test indicates that the chances of you having heart issue are very low, but a positive stress test only indicates that you may have a heart attack problem, which needs further evaluation. So that is very important. Medications are important. Angiography and angioplasties. So angiography is just a diagnostic test where we see where the blocks are, and angioplasty is where we actually open up the blocks. Vaccination in heart patients is very important, especially after 50 years of age. So pneumococcal flu vaccines are regularly given to our patients. Now we've added zoster vaccine, that is a shingles vaccine, also to patients who are suffering from heart diseases. Very intriguing topic of bacteria and heart diseases. So it's still not proven, still require a lot of data which shows that bacteria from the oral cavity, from the gingiva, that is your gums and your teeth, can actually travel to your heart, cause blockages in the form of inflammation. I'm not going to dwell much into this because it still needs to be proven. Cholesterol, very, very important, which we are going to speak on. Just going to differentiate very briefly. HDL is the good cholesterol, which keeps your arteries clean. So it picks up the cholesterol from the lipoprotein picks up. So high density lipoprotein picks up that cholesterol and takes it to your liver for your metabolism. While LDL is a bad cholesterol, which actually deposits the cholesterol in your vessels. So as I said, when the vessel wall fills with cholesterol, the vessel wall slightly bursts and causes that clot, causing that heart attacks. So LDL is bad cholesterol, HDL is good cholesterol. The levels. So LDL levels should generally be kept under 100 for normal individuals. A patient who's undergone an angiography or an angioplasty and has a heart disease, I generally like to keep the LDL levels below 50. So there is not one figure which you can actually, say that this is what it is. So diabetes is the major issue because people say that I have a sugar of 200, which is normal, and I absolutely have no issues with that sugar, but that is wrong. Diabetes again acts on the vascular level, the endothelium, that is the vessel wall. There are no symptoms which will develop. You will probably just come with a heart attack. And number two, in diabetics, there is some amount of nerve damage, so you won't even get that classical chest pain in a few individuals. And that is why we generally recommend that sugar should be very tightly controlled in patients who have heart diseases. People then come to me and ask me, what does a good diet look like? So there are multiple diets, which my next few slides is going to tell you. I'm not going to go into the details of it. That a good healthy diet constitutes a lot of vegetables. Lean meats are okay. Milk products should be avoided. It should be high in fiber and vegetable content. So this is now coming to hypertension. This is what a hypertension will actually look like. Uh, there is a misnomer that any individual above the age of 50, 140 is also a normal range, which is absolutely wrong. It is proven beyond any reasonable doubt that any pressure of systolic above 120 end organ damage, that is, the other organs of the body cannot take it and start getting damaged. So it is essential, irrespective of your age, that you should keep your systolic blood pressures to less than 120. Obesity has been on the rise, and it is shown that it increases your prothrombotic, that is, your clotting factors increase. Insulin resistance increases, blood pressures are higher. You have something called even obstructive sleep apnea, which I'm going to speak about. Your inflammatory profile increases, and this actually increases your chances of having heart issues. So generally, we have a BMI 18.5 to 24.9, which is normal, plus the waist circumference 40 inches for men and 35 for women is taken to be normal. Diet for weight loss, everybody knows it. Everybody knows it, but we generally don't follow it. So as you can see on the right side, the Atkins and the DASH diet are generally for hypertensive individuals where you have low carbohydrates and you have low salt diet, and the Mediterranean and all are for probably keeping your sugars under control and metabolic factors to be under check. These diets are available online and we can always search for it and follow it. Calorie intake is very important. If you see the DASH eating plan, DASH and the Mediterranean diet. Now I'll come to the reason why these diets are very, very important. So it was found that in coastal Europe, coastal Eastern Europe, individuals used to have a good amount of serving of food, but their chances of developing hypertension and diabetes was very low. So they dwelled into it why. So they brought out the diets that their diets are very rich in fruits, vegetables, lean meats, that is in the form of chicken. There is no red meat in that. Sweets are to the minimum, and they don't have any sugar sweetened beverages. Their salt intake is also to the bare minimum. So that is why they have less fat. So that's why it's called the Mediterranean diet, and that is very very important. Coming to the smoking aspect of it, the alcohol aspect of it. Uh, I have patients who come to me and say that I have read that the alcohol is good for the heart. Alcohol, I correct them that alcohol in less quantity or in moderation is good for the heart. In high quantity, it again increases your oxidative stress, your lipids, your RAS. So any binge drinking is very bad for the health. It will increase your heart rate. It will cause something called atrial fibrillation. Also, it is known. It can, even if drinking is to a high extent, it can even cause something called alcoholic cardiomyopathy, where your heart pumping goes down because of the alcohol. Pressures also go down in a big way. So a standard drink would be 1 pint of beer or 340 ml of, probably a small wine, 140 ml or 40% proof alcohols of 40 ml. So you have your no risk, low risk. I just keep them at no risk. I said no drinking is good for health, so we'll keep it at that. So that is good. Smoking, people say that I have nicotine free smoke, which is absolutely wrong, because nicotine, it's not only the nicotine, but it is the tar, acetone, ammonia, benzene, cadmium, and formaldehyde, which you can read that they are so bad for the health. Even just reading it would give you a little stress. So, as you know, tar, which you use, which is so carcinogenic, acetone, which you use in your nail polish removal, cadmium, which is found in your batteries, you can find them in this pack of cigarettes, and they are absolutely a no-no. It is never to reduce smoking, it is always just to stop it. You can never stop smoking. So vaping is as bad as smoking, and there is no two ways about it. And it is proven beyond doubts that e-cigarettes also have any bad effect on it. How do you quit smoking? I would never say decrease smoking. It's just quitting smoking. So you have nicotine patches, gums, which you can use. You have medications, something like varenicline, which is now available in the market, and bupropion also, which actually changes your cognitive behavioral patterns and actually can have a beneficial role, and patients are known to stop smoking. Stress, as I said, was a non-modifiable risk factor, and actually it is how you deal with the stress is very very important. So a type A personality who is very difficult in dealing with stress is actually going to have more issues. Anxiety, depression, chronic stress, you fall in this circle of stroke, heart. So this is a CDC slide, so you can actually see how stress can affect different parts of your organs. Sleep apnea, I'm not going to dwell much into it, but as you know that individuals generally who are well built, who are obese, generally snore at night, and this is what has happened. The tongue falls back, blocks the airway, that causes the snoring, that decreases the oxygen level. So the patient may not get up, but his mind gets up. That's why he has daytime sleepiness, he has headaches, his blood pressure starts to rise. Uh, you know, there are memory problems, and of course snoring, which I spoke about. And this also is known to cause a lot of heart issues. And once you take care of this obstructive sleep apnea, it is shown that patients actually can go off even hypertension pills, and their heart diseases also improves. So there are multiple therapies, proper therapies, the CPAP, which gives oxygen at high levels. Weight loss is the most important. Surgical treatments are generally not done, and as I said, lifestyle changes are important. So, in a healthy diet, exercise is also very, very important. 150 minutes of exercise every week is known to actually decrease your heart issues, and is actually known to increase well-being. So this brings us into an overview of actually what a healthy heart is, what a healthy diet includes, and that is about it. Thank you so much.